Dear ladies and gentlemen, welcome to ESC Asia with APSC and AFC. I'm Stefan Achenbach, President of the European Society of Cardiology. And for me, it's a true honor and pleasure to welcome you to this joint event, where the ESC, in the tradition of close collaboration over many years, in a tradition of trust and in the mutual focus on patient care, works really closely with the Asian Pacific Society of Cardiology and the Asian Federation of Cardiology to bring the newest in science to you. The focus of this conference will be what has happened at ESC Congress 2020, the digital experience, but we will always, of course, look back at all other developments during the past year. And the reason why we're doing this is that we have a joint mission. In our focus on patient care, our mission is, as we worded in the ESC, to reduce the burden of cardiovascular disease. That burden is tremendous, but luckily we continue to obtain new tools to fight cardiovascular disease and to help our patients. And if you only look at some of the aspects that were new at ESC Congress 2020, there's so much that we should and can talk about. There's more data on SGLT2 inhibition in heart failure, the EMPEROR-reduced trial, for example. There's data on the SGLT2 inhibitors in chronic kidney disease, DAPA-CKD. There's new data, very interesting data, whether colchicine, an old drug, can help our patients with coronary artery disease. There's new data, very pragmatic and important for clinical practice, on how to proceed with blood transfusions in patients who have an acute coronary syndrome and anemia, the reality, very pragmatic trial. And we also have a number of completely new drug classes that presented the first data this year, and one of them is mavacamten, as can be used in patients with hypertrophic cardiomyopathy. And the Explorer HCM trial looked at patients with hypertrophic obstructive cardiomyopathy. So lots of new scientific information, and the role of professional societies and the role of symposia like this is to discuss these findings, to interpret these findings, to initiate exchange about the relevance of these findings in numerous parts of the world. And this is why it's so valuable to have this joint symposium, this joint congress with you and with the three societies, ESC, APSC, and AFC. So thank you very much for being here with us. And I would like to turn the microphone to Jack Tan, President of APSC.
Thank you, Professor Achenbach, for introducing the session. My name is Jack Tan, the current President of the Asian Pacific Society of Cardiology. And on behalf of APSC, I welcome you to ESC Asia 2020. The APSC consists of 22 cardiac societies across the Asia-Pacific region, from the Middle East, East Asia, Southeast Asia, down to Australasia. These are my APSC Executive Council members, and they have contributed greatly to this collaboration with ESC and AFC for this year's event as well. And I'll take a moment to acknowledge their contributions. The APSC has always been engaged and interested in involving the young cardiologists of tomorrow. And with that, we have an APSC Emerging Leadership Program, started in Singapore in 2017, followed by Taipei in 2018, Seoul in 2019. And for this year, due to COVID-19, we'll switch to a webinar format. And hopefully by 2021, we can see everyone again in Hanoi, Vietnam. The APSC has also launched a series of APSC CME webinars during this challenging pandemic period. And we are very happy to have multiple programs simultaneously from across the region in conjunction with our APSC stakeholders as well as APSC Cloud. I'm also very happy that we started with a handshake collaboration with Professor Michelle Komajda in 2018. And together with the ESC leadership, we started ESC Asia, the inaugural event in 2019. And we're very happy again, in spite of the fact that this year you'll be in a webinar series for ESC Asia to be on the 4th to 5th of December. Next year, we're looking forward to ESC Asia on the 3rd to 4th of December in 2021. The EPSC has also switched to a Hard Talk leadership series in replacement of the Emerging Leaders Program. With us, we have the first event with Professor Carolyn Lam, followed by Professor Richard Chazelle and Professor Kenny Sin. We are soon to release our subsequent events with Professor Jerome Bax and Professor Greg Stone. This series of engaging leadership topics hopefully will enthuse our younger generation cardiologists into future leadership roles. The APSC, recognizing that we do not have enough concrete level 1 evidence addressing the Asian cohort, has launched into a series of APSC consensus statements, recognizing that we can't absolutely follow all the guidelines from our European or American colleagues, and there are contemporary topics that need a consensus recommendation from our stakeholders. We have a series of statements addressing CAD, PAD, and CCS, lipid management, MitraClip, the use of high-sensitive troponin T assays, management in AF patients with NOAC, ticagrelor use, as well as type 2 diabetes facing for cardiologists. And I'd like to again take a moment to recognize the participation from my Asia Pacific stakeholders for this multi-pronged efforts. The APSC is also very happy to announce the award for scholarships across Asia for deserving candidates to come train in Singapore for advanced cardiology subspecialties. And in 2020, we'll give out a further 8 scholarships in spite of COVID-19 to this very deserving group of fellows from across Asia Pacific. The APSC is also very happy to have, in conjunction with ESC, the EEGC, to set a series of questions to pilot the APSC ESC exit exam for general cardiology as a piloting benchmarking exercise. We're also very happy to have this effort come about from a generous education grant from Dr. Weil from the UAE. This event was supposed to have occurred, the examination, in June of this year. It was further postponed again from November 24th due to the second resurge of COVID-19. And we hope to have this exam happen latest by first quarter of 2021. Yeah. So thank you everyone for attending ESC Asia 2020 this year. And in light of the circumstance, we are very happy to offer this event by a webinar free to register format. And we hope that everyone will have a very fruitful educational journey. The APSC will also endeavor to have subsequent follow-up events in 2021 in Bangkok, 2022 in Kobe, Japan, 2023 in Singapore, and 2024 in Dubai, UAE. And we hope to see everyone on site soon. Thank you very much.
Very good morning, everybody. Dear colleagues and friends, I'm delighted on behalf of the Asian Federation of Cardiology to deliver this welcome speech for all of you, our guests in European Society of Cardiology Asia Congress 2020, in collaboration with the Asia Pacific Society of Cardiology and Asian Federation of Cardiology. This Congress is a scientific event like no others, a groundbreaking cardiovascular science assembled in an entirely digital format. And the scientific events provide 2 days of exciting, unique insight, virtual experiences, and innovation for medical practice, particularly in the midst of the global pandemic COVID-19. The scientific committee has been preparing this Congress very judiciously. Our unrelenting objective is to shape an ever stronger scientific programs with new ways for you all to meet and engage together online. As we know that Asian cardiologists and medical professionals in the region would encounter a more diverse clinical pictures due to cultural ethnicity background and even more different genetic backgrounds. The emerging cardiovascular disease risk factors have been arising in the last 2 decades in the region, such as hypertension, dyslipidemia, metabolic syndrome, and diabetes mellitus. These cardiovascular disease risk factors will make the clinical picture and medical challenge more complex. About 8% of the population of the world live in Asian countries. That means about 650 million people residing in these regions. Asian residents come from some diverse cultural, ethnic, economic, and social backgrounds, but we live peacefully in harmony. In this occasion, I would like to remind our Asian vision aim to see an outward looking playing a pivotal role in the international fora and advancing Asian common interest. Our common interest now is to prevent cardiovascular disease and to provide the highest standard of cardiovascular disease medical care across the region as well as mitigating COVID-19 pandemic. Fortunately, there are some new guidelines 2019 and 2020 are issued this year by European Society of Cardiology to address this particular cardiovascular disease problem in Asia, namely acute coronary syndrome in patients without persistent ST elevation, atrial fibrillation with a new classification, dyslipidemia with PCSK9 inhibitor as a main actor still on board, diabetes mellitus and new data of SGLT2 inhibitors for heart failure. Interestingly, the old ballot revisited colchition for cardiovascular disease prevention and sports cardiology and exercise in patients with cardiovascular disease, and lastly, chronic coronary syndrome. And I'm assured that these programs will be providing some practical solution to daily practice. Again, more interestingly, there are some Asian research will be presented in this prestigious meeting as well. This Asian research certainly will represent the evolving issues encountered in daily practice in the region, and it is appropriate to get attention and solution to this Congress. As such, be sure have a scientific journey during this Congress. Thank you very much.
Good afternoon, ladies and gentlemen. I'm Komajda from Paris, France, and I'm very glad to welcome you to the second ESC Asia event. I'm the chairman of the organizing committee and the co-chair of the scientific committee. Due to the COVID pandemic, we have been obliged to move to a fully virtual meeting, but the scientific committee has tried to make our event exciting. We keep the purpose of the first edition, which is to favor interaction between colleagues from the Asian Pacific area, together with colleagues from the European Society of Cardiology. And we in particular want to target junior cardiologists or cardiologists in training and provide them the best science coming from the annual meeting of the European Society of Cardiology. Since we are virtual, we will have only short lectures followed by a discussion between experts from Asia Pacific area and from Europe. Please pencil in your calendar already the dates of next year where we hope to be able to meet physically. Our 2021 ESC Asia meeting will take place on December 3rd and December 4th, 2021. I would like now to briefly mention that during these 2 half days, we are going to review 3 important ESC guidelines which were released last August: the guideline on non-ST elevation marker infarction, the guideline on atrial fibrillation, and the guideline on sports and cardiovascular diseases. And of course, ESC Asia will discuss whether these guidelines apply and are relevant to Asian Pacific patients. I would like now to hand over to my co-chair of the scientific committee, Professor Chieh, who will tell you more about some exciting sessions during our meeting. Enjoy the meeting.
Hi, my name is KK Yo from Singapore. Welcome to ESC Asia 2020, a partnership with ESC, APSC, and AFC. Together with my co-scientific chair, Komajda, a warm welcome. These are difficult times for all of us around the world, and it is during these times that partnerships in science and in medicine across the oceans is all the more important. I'm glad that we are able to continue this very important program to improve the medical education for all of us here in this part of the world, together with our experts and friends from Europe and within Asia. So you have heard from Michelle some of the exciting program we have lined up for you. We have other exciting material as well. I'd like to share two in particular. First, we have controversies which will be in the form of mini debates. The first is regarding the use of colchicine in patients with coronary artery disease. You will hear from Mark Neidorf from Australia and Stefan Gillen from Germany as they debate whether we should use colchicine routinely in patients with coronary artery disease. Second, there will be a debate on the use of SGLT2 inhibitors in heart failure patients. Should this be the routine for all such patients? You will hear from Professor Caroline Lam and Professor Michelle Komajda as they debate this hot topic. And lastly, we have an exciting session where we will select the top presentations, clinical case presentations in a session for the four top cases. We hope that you will learn from these exciting cases from within Asia. And together with the rest of the program that Michelle has shared, we believe that this will make for an exciting program for ESC Asia 2020. Thank you and welcome.